Hey everyone, welcome back to our dermatology playlist. Today we're diving into rosacea, one of the most interesting dermatologic topics I've studied about, and I bet some of you guys at least have seen patients with such noses. I used to think that they get it with age or either they were born with such noses. And the thing is, there's an actual whole disease and a pathophysiology underlying this condition. So let's dive into this. So by the end of this video, you'll be able to define rosacea and its key differentiator from acne, explain multifactorial pathogenesis, identify the clinical subtypes and the hallmark features, and lastly, recognize common triggers. And this is probably one of the most interesting yet important points that we're going to discuss in this video. And then lastly, the treatment strategies. And as usual, to make it easy for you to follow along this video, I prepared a free visual cheat sheet that you can easily get if you visit our website visceraverse.org, then go to Sketch Library page, and from there click on Dermatology playlist or category, and then you can simply download it from there. So what is rosacea? Rosacea is a chronic condition involving both inflammation and abnormal blood vessel reactivity. It looks pretty much like this, typically a red face, and you may tempt to think that this is acne. However, this is a different condition called rosacea. It is most common in adults, ages between 30 to 50, especially fair-skinned individuals, as you can see on the screen here. It primarily affects the central face, including the cheeks, the nose, the forehead, which we don't see here, and apparently the chin. Key differentiator from acne is that there is no comedones or blackheads, whiteheads, and rosacea as compared to acne. So what are the underlying mechanisms? What is the underlying pathogenesis behind rosacea? One of the most important things is innate immune dysregulation. This is when there is an increase in toll-like receptor 2, leading to abnormal cathelicidin. Cathelicidins are small antimicrobial peptides found in humans and other species, and if these are abnormal, that simply leads to inflammation and vasodilation. Vascular hyperreactivity, that leads to flushing and telangiectasia. Demodex follicularum, this is interesting because this is actually a skin mite, and if there is overgrowth in this skin mite, that's going to trigger immune response. Lastly, reactive oxygen species. These contribute to inflammation furthermore. Now that we understand the pathogenesis of rosacea, let's talk about the triggering factors. What could actually trigger this? Foods like spicy foods, beverages including alcohol and caffeine, factors including stress, or heat and cold, sunlight and wind. There are many clinical subtypes of rosacea. It is not only this, as we discussed in the beginning of this lecture. This case is called rhinophyma, but there are actually many other subtypes, including Erythematotelangiectatic. This is a persistent redness, visible blood vessels, aka telangiectasia. The Papulopustular, like this one you see on the screen here. This is redness plus papules and pustules. It's acne-like, but there is no comedones. The phymatous form, the most interesting one for me at least. The skin thickening, most commonly rhinophyma. This presents with an enlarged nose. So this is my handwritten illustration to make things easier. Rosacea can present in multiple forms, including the erythematotelangiectasia, as you can see on the screen here. You see these little vessels that are clearly visible. This is telangiectasia, and that's for the erythematotelangiectasia form. Another form is the papulopustular, and this mimics acne. However, we have no comedones in this case. Another interesting form is the phymatous form, and this is more common in males. One more thing is the ocular, and this is where the patient presents with reddish eyelids, and that could be unilateral or bilateral, and in this case we need to refer them to an ophthalmologist. Ocular rosacea presents in up to 58% of patients. Symptoms include dryness, burning, gray sensation, and blurred vision. And the findings including blepharitis, these are where we have red eyelids, conjunctivitis and the inflammation of the conjunctiva, styes, and keratitis. And all of these could be threatening to the vision, and again, we refer them to an ophthalmologist. Lastly, let's talk about the treatment of rosacea. Step 1, in all patients, it's important to educate them, trigger avoidance, and daily sunscreen. Step 2 is topical drugs, including metronidazole, azelaic acid, ivermectin, and this is especially important because it kills the Demodex mites. Another important drug here is brimonidine. This is an alpha 2 agonist and it helps in redness and erythema. Step 3, systemics, including doxycycline, low dose, isotretinoin, especially in severe orthomitis cases. Step 4 is procedures, including laser, PDL, pulsed dye laser, or YAG laser for redness and vessels, and surgery for FIMA. Alright guys, that was everything about rosacea for today. I hope this helped you understand this topic. Don't forget to subscribe for our next video, and don't forget to claim your free summary PDF from our website visceraverse.org. And lastly, let's become friends on Visceraverse on Instagram. See you there, and see you in the next video.